Well, hey guys, I'm Dr. Ben, founder of Well Health and Chiropractic, and I'm excited to tell you the 3-step process that we have here at Well to transform your life. At Well Health and Chiropractic, we focus on 3 major things: finding the vertebra, moving the vertebra back to its correct position, and then restabilizing the muscles, ligaments, and tendons so that it stays in the right position. So we are a corrective chiropractic office, and let me tell you why that even matters. First and foremost, the way that God designed your body is He gave you a brain and spinal cord that controls every single organ, cell, tissue in your body. It makes your heart beat, your lungs breathe, your intestines to digest. It makes your hands be able to feel and your fingers be able to move. The way that your body has to work is the message has to make it to the organ. God gave us 24 movable vertebrae that surround and protect your spinal cord and your spinal nerves. Most people don't realize that these nerves actually exit between 2 bones. So when the bones are in the correct position, there's no pressure on that nerve. These nerves signal can get to your body at 100%. The problem is when your vertebrae shift out of position, now what happens? Well, you pinch that nerve. And when you pinch the nerve, what happens to your organ? It doesn't work correctly. Let me show you. If this nerve were going to your heart and I cut that nerve, what happens to you? Well, you die. When? Now. What if you don't believe that? Doesn't matter. Turns out you're dead and you're wrong. Because this is not a belief. Chiropractic is a tool. It's a tool to move a vertebra. We know if we cut the nerve, your heart dies immediately. If the bones shift and pinch the nerve, the heart starts dysfunctioning or functioning incorrectly immediately. And what does that look like? In real world, when you pinch the nerve to your heart, blood pressure goes up, plaque and cholesterol goes up, blood gets thick, doctor puts in blood thinner, blood pressure medication, and you're on all these medications. But let me ask you this, is there any blood pressure pill in the whole world that can unpinch a nerve? Nope, doesn't work. That's where chiropractic comes in. So let's say, for example, you're somebody who shifted a vertebra out of position, maybe playing sports as a kid, maybe you spend too much time on a computer, maybe you drive too much, whatever, and you've shifted a vertebra out of position. Maybe you did that like 10 years ago. That means that the muscles, ligaments, and tendons have been holding this bone in the wrong position for 10 years. So you could imagine, as a chiropractor, if I just went through and moved that bone, but I didn't work on the muscles, ligaments, and tendons, within a day or 2, what happens? The bone, it's going to move right back into its old position, and it's going to repinch the nerve, and your organ's not going to work correctly. If it's causing pain, the pain's going to come back. If it's causing high blood pressure, the blood pressure is going to come back. At Well Health and Chiropractic, we focus on 3 major things: finding the vertebra, moving the vertebra back to its correct position, and then restabilizing the muscles, ligaments, and tendons so that it stays in the right position. So let me show you how this works. Come here. We start in a room like this where we do a full exam and we'll go through history, doing the normal doctory stuff. Come on with me. And then we wind up shooting x-rays. Here at Well, we do high frequency digital x-rays. And the reason we do that is because we need to see where these vertebrae are. Now, inherently, we can't see the nerves, but we can see the bones. So when we shoot this x-ray, I will be able to see if your bone's in the right position or the wrong position. And we'll know day 1, are we allowed to adjust you? Is it going to do you any good? And is your problem caused by a bone out of position pinching a nerve? After we shoot our x-rays, now we're going to do a corrective chiropractic adjustment. What you're seeing now is an example of a typical chiropractic adjustment. Now, there's many different techniques and tools that we can use with chiropractic. However, this is a typical example. As you can see here, I'm adjusting somebody's low back. This is their middle back. This is the thoracic spine. And then finally, we're adjusting their neck. Our techniques are both gentle and safe. As a matter of fact, our doctors are skilled and highly trained to make sure that we deliver the most effective adjustment that also feels good. Now, let me show you some of the secret sauce to the corrective adjustment. The secret sauce is that we have to get the muscles, ligaments, and tendons stabilized and strengthened before and after the adjustment. So you can see in here we have these wobble discs. This allows us to do what's called active decompression, where we can loosen up and heat up the ligaments and discs in your body before the adjustment. Then we come over here and we do what's called repetitive cervical traction. What this does, this is a device that you put behind your neck, is that allows you to heat up the disc in your neck. That's super important because we don't ever want to adjust into a cold disc. And when you get adjusted, we want these ligaments to be super relaxed so that way it can stabilize after the adjustment. So then we do these 2 warm-up exercises, we get a fantastic adjustment. Then we come over here to our Vibe platform. These actually vibrate, and you pick how long you want it to vibrate. Actually, you can't see this on video, but it's shaking me, so I'm going to turn this off. But what that does is this platform vibrates at the resonant frequency of a disc. And what it also does is it fires your very small paraspinal musculature. So when you get done being adjusted, we've moved the vertebra, we've loosened it, we've moved it. Now we need to strengthen it. So we stand on here with perfect posture. And we allow this Vibe platform to stimulate the little muscles in our spine, so it's like them doing a workout at the gym, but you can't normally do that. So we stand on this for usually 5 to 10 minutes, and that allows that paraspinal musculature to be strengthened. So that's our 3-step secret sauce to a Well Health and Chiropractic corrective adjustment. Listen, if you want that, if you want us to look at you and get you adjusted so you can feel that process, make sure you click below on the new patient special. Guys, listen, I'm Dr. Ben, and I look forward to seeing you soon.